So last week or week and a half ago, we spent a little time over kind of a lunch and learn while I was actually getting sculpt. I was getting ready for 4th of July. I knew I was going to be in a bathing suit, trying to maintain my core strength. And we talked about Sculpt Neo, which is a technology that muscle tones and helps with fat reduction. And anecdotally, we even see some skin tightening sometimes because of the heat. But we wanted to talk about a slightly different technology that we have over here in the Body Suite, very tried and true, and something that Kristi has been doing a long time and has actually educated on. So do you want to introduce what this magical machinery is?
Magical machinery. This is Coolsculpting. Coolsculpting is actually freezing the fat. So what we do is it is used for volume reduction, so targeted volume reduction in many areas, at least 9 areas on the body or more, we can use it on. And I use it for targeted volume reduction in where there are pockets of excess adipose or fat. And I love it because it is so reliable. If someone comes in and has excess volume in the abdomen, in the thighs, I can use inner thighs, I can do outer thighs, we can do arms. So it's fabulous for the summertime, getting those little areas truly sculpted for bathing suit season. And again, safe to do in the summer, so it's a treatment that we can do in the summer. You get about a 30% reduction per treatment. Most patients do need an average of at least 2 treatments, and they're done about a month apart. And you see your optimal result about 3 months after your final treatment.
So is it temporary or permanent?
It is a permanent fat reduction. So anything that we remove with Coolsculpting is permanently gone, which is the beauty of it.
Yeah, so as adults, we have a certain number of fat cells. And so this is freezing the fat, and basically it causes crystal formation in the fat cells. And so with long enough treatment times, which are typically like 20 to 30 minutes, they cause enough tissue damage that the cells don't survive. And so our body breaks that down, eliminates it through our natural processes that turns over cells all the time. So I think that's important to know. I get asked by patients, well, is it going to come back, or what happens? If you're maintaining same lifestyle, relatively similar weight, it's not as though suddenly you're going to get a fat pocket on your right shoulder or something like that.
Exactly.
But if you do gain 20 pounds, you will redistribute fat, and just the cells you have become bigger. It's not that you grow new ones, but you'll have that distribution in sort of the proportion of what your body frame is after treatment.
Right.
So I think that's a question I get asked a lot.
Same.
In terms of downtime, I've had Coolsculpting, so I think a couple years ago,
Yeah.
we were looking, and I was like, Kristi, I know I don't have body dysmorphic disorder, like one armpit
So we just did
had
that.
like a little bit of extra fat. We could see it with how my clothes were fitting, and if I was in a tank top. And I know that sounds ridiculous, but we've got this little Coolsculpt Mini, and we do get asked about that. I had seen another patient, I actually saw, because I had before and afters from someone you were showing me, and so we can get small pockets. People, good candidates should be people with reasonable lifestyle. This isn't a means of weight loss, but this is really for dietary and exercise resistant areas of that.
So contouring,
inner thighs, treating sort of circumferentially. Women, as we reach perimenopausal ages, and gentlemen really struggle with this sort of circumferential abdomen to flanks. We can help that a lot. And so oftentimes Kristi, when she's developing some of our treatment plans, I'll refer patients to her, and we want to debulk first if somebody has a little bit more pinchable fat with something like Coolsculpting, and do a couple series of that. And then we'll move over to the Sculpt, which we showcased last time, and really get muscle tone back, get some further fat reduction, and that way I think you're sort of removing the fluff layer first, and then you're actually toning afterwards.
Exactly.
The other thing that we really talk to patients about is, this is something that we were involved in some of the studies, and I mentioned this last time. We were involved with the Sculpt study. Dr. Marati, who's a wonderful plastic surgeon here in the San Diego area, he actually did a split abdomen study where Coolsculpting was done on both sides, but this Elastin Body Transform was used on one side, topical application twice a day, starting a couple weeks before treatment, and the other side just the vehicle, so not the active ingredients in it. And when we mirror imaged and look at volumetric changes in the before and after images, there was a 30 to 50% reduction that was greater on the side where we did the body transform than not on the untreated side, just the normal cream.
Exactly.
And so for that reason, it is standard of care in our practice. If you're going to do Coolsculpting, or even if you're doing M-Sculpt, which we can help with fat reduction a little bit, and just to help with collagen and elastin stimulation, which the Trihex technology does so well, we put patients on this because it sounds a little too good to be true that a topical cream can help, but this actually goes down the hair follicle into the sort of deep white adipose fat tissue that's right around the hair bulb, and that transmits signals to the deeper fat. So there is an actual mechanism of action of how this works. This isn't voodoo science, or we're putting some tuning fork over things. There's reputable results that we've seen, not only in clinical studies, but then over the years in our own patients as well. We also wanted to, I don't know if you have any other points just related to Coolsculpting.
Just come on in for a complimentary consultation. That way I can develop a personalized treatment plan for you. We can go over, which body parts are, bothering you, and see what we can do. But every treatment plan is truly personalized. There's no cookie cutter.
Yeah, so it truly is bespoke.
It is.
I mean, we don't believe in cookie cutter. Right. We believe in authenticity here, and I think it's really important that we're listening to you guys as patients, and that we're able to be realistic, but also sort of forward thinking in what we can accomplish with some of these non-surgical sort of treatments that we have to offer in terms of sort of body toning, fat reduction, muscle toning, skin tightening. And then as sort of a preview to what I think we'll talk about next, we're going to continue this series and do something roughly every week and a half or so. But it's summertime, and so patients, obviously we're in San Diego, people are going on vacations, there's a lot of sun exposure, so I tend to not do as much laser and light treatment here in the practice because of concern for that downtime, the need for sun protection afterwards. But some of the peels we offer, I think, offer limited downtime, and if people are good about sun protection afterwards, we can really do a nice job. So something I did almost a month ago, we're going to preview it on camera next time we do one of these, and I think we'll probably do like a later afternoon near the end of our clinic day. But about a month ago, I had the VI Precision Plus peel. I actually have melasma, and patients are like, no you don't. I'm like, exactly, because I'm on good topical therapy, I'm doing chemical peels, I do spectra peels every once in a while. And I really am careful about sun protection. I actually take an oral supplement called HelioCare Ultra, which was actually developed to help with melasma patients. And it's a systemic, just antioxidant from a fern plant. But we will talk about VI Precision Plus. You'll see me actually having it applied. It does not hurt. It's got fabulous ingredients, some of which are typically medium to deep chemical peeling agents, but the combination of them is very safe. And typically I used to tell patients you would peel day 3 through 5 with it. But what we're finding, we're going to give you some tricks with a couple of products. One is like brand spanking new the last couple months that we are using on everybody. It's called CMT. It's a product from Revision. I am using it on laser patients, microneedling patients, PDT patients, laser resurfacing patients. We're using it on our chemical peel. So when I had this done about 3 weeks ago, I use the CMT cream twice a day, and then we'll talk about a product called Secura Silk, and hardly peeled. You don't have to peel to get results from peels, and this really, I think, makes it a much more tolerable peel, so you're not like cheap, peeling for 3 days, about day 3 through 5 afterwards. So little preview of things to come, but something we can do during the summertime, and we have specials on if you're doing a little package of 3, super easy to do. So with that, thanks for tuning in, another little Kristi and Dr. Palm. But next time you can see Dr. Palm getting a little peel action. But again, if you have questions, Kristi's such a wealth of knowledge. She has been doing body contouring for almost a dozen years, I think now, and has been an educator for Coolsculpting Academy. So she truly is an expert in this field in how to evaluate a body, how to get results, and that's really. I think really important, because sometimes unfortunately we get consultations where people have been treated elsewhere and just not as much thought has been placed in that. So again, you got questions, we're on at lunch now, but phone number is 858-792-7546, and our consultations are complimentary with Kristi. So hope you're having a great summer. We'll see you guys for the next episode.